الورك يبقى فيه افضل يعني. وان شاء الله بعدين يبقى يوسف هشام ان شاء الله باذن الله. شكرا جدا.
Good morning, dear professors. I'm Sara Raafat. I'll be presenting the pediatric interesting case along with my colleague Khadiga. This is under the supervision of Dr. of our own professor, Dr. Shayma Absattar, to whom we owe a lot. Now, our case seemed very unimpressive in the beginning. It's a 14-year-old boy presented to the radiology unit. The patient is non-CP and is seeking governmental documentation for insurance purposes. Now, this is very uninteresting, I know, but the findings are interesting indeed. I will leave you with the images. I'll scroll through them and see if you can spot it. Now, did you see anything? Here we go. Oh, the timer is ticking. Okay. Do you want one more time?
Yes, please.
Okay. All right. All right. Now, going through the supratentorial imaging findings. Now, it starts really boring. It's ventriculomegaly, a little bit of a periventricular white matter volume loss. Well, very classical for CP patient. If you're too meticulous and get it next to a normal counterpart, just for comparison, you can notice a subtle microcephaly. You can also notice that the periventricular white matter volume loss is more prominent posteriorly. Now, that's not interesting. The next slide is, can you spot it? First, your eye will catch that the basal ganglia does not look how it's supposed to look. Putting it next to its normal counterpart, you can find that the basal ganglia, the head of caudate, and the putamen are fused together, and the anterior limb of the internal capsule is nowhere to be found. On the left side, similar finding. The basal ganglia is dysmorphic, fused together, and the anterior limb is not there. Now, going to the sagittal image, maybe for untrained eyes like ours, you wouldn't spot it right away, but next to the normal counterpart, you can clearly see that the corpus callosum is thinned out. Going through the infratentorial findings. Now, the first thing that catches your eyes is a wide retrocerebellar CSF space and maybe this plastic cerebellum. But can you spot something more? Next to its normal counterpart, you can see that the brainstem is asymmetrical. There is asymmetrical thinning in the left midbrain cerebral peduncle. The pons as well. You can see that there is asymmetrical thinning in the left hemipons and pontine cleft. There is also, in this image, you can wonder, where is the verms? Is this also a case of vermian agenesis? So we go to the sagittal T1 image. There it is. The vermis is there, but putting it next to its normal counterpart, you can easily spot that the vermis is dysplastic, along with the cerebellar dysplasia. Now, to put all of these findings together and to reach a single conclusive diagnosis, I'll leave you with my colleague Khadiga.
Okay. This is a case of tupulonopathy, complex cortical malformations associated with mutation in tupulin genes. It's a heterogeneous group of disorders with with a wide spectrum of clinical severity. We will discuss in brief the cortical malformations reaching to the tupulin gene. The formation of the cortex of the mammalian brain requires a coordinated timing of proliferation and migration, layering, as well as distinct neuronal differentiation. Here, we will reach the classification: abnormal neuronal and glial proliferation, and abnormal neuronal migration, abnormal post-migrational development. Tupulonopathies here discuss neuronal migration disorders, which is highly dependent on the tupulin genes. The microtubule cytoskeleton, which is composed of polymer of heterodimer that is composed of alpha and beta tubulins that is assembled together. Each tubulin isotypes is encoded with certain genes. There is various genes, so we have different subtypes of tubulinopsis with specific cellular properties and functions. The finding, as Sara discussed them, the supratentorial imaging, corpus callosum abnormalities, lost definition of anterior limb of internal capsule with dysmorphic basal ganglia, dilated ventricles, abnormal cortical malformations. Infratentorial imaging finding, vermian dysplasias, and cerebellar dysmorphic changes, as well as asymmetric brainstem. Okay. Thank you.
Thank you.